One of the most difficult times for parents of children with autism is when the child has a meltdown. In this brief presentation, we'll discuss some approaches to dealing with meltdowns. It's important to notice that meltdowns are not a choice. They're not manipulative behavior, they're not tantrums. During a meltdown, the child has lost the ability to stay regulated. What does a meltdown look like? We've all seen them. Manifestations can vary from child to child, but they may include throwing themselves on the floor, acting out, crying, swearing, screaming, throwing things, hitting themselves or others, running away from you, or biting. Another important thing to know about meltdowns, especially with children with autism, is they can last a few minutes or they can even last for hours. Meltdowns usually proceed in a cycle. So there's an escalation cycle and then there's a de-escalation cycle. It goes from the calm moment, something triggers the potential meltdown. There's a phase in which the child becomes more agitated. This agitation accelerates and it reaches a peak. After the peak, there is a de-escalation. And actually the de-escalation leads to a post-crisis depression. And there's depletion at the end of the de-escalation process, and finally there's a recovery. All of these are critical moments and they all require a different approach. At all stages of the meltdown, and this is really not easy, you have to stay calm. The temptation to counter the child with a degree of aggressivity or punishment or discipline does not work. You cannot discipline or reason with a child during a meltdown. This is a time in which children have lost their ability to regulate themselves. In the different phases, there are different approaches you can take. During the initial phase, when the meltdown, the potential meltdown is triggered and you're entering a phase of agitation, you can apply reflective listening, which is paying attention to both the words and the body language. Let the child talk. Try to understand what the child's emotions are. Keep your answers and your communication short, concise answers. Give the child some space and remain supportive. As the meltdown accelerates, you can offer the child an out. Basically offer to choices. For example, clean your room, or if not, go to bed early. This might give the child an opportunity to direct away from a possible meltdown. During the most critical phase, which is acceleration up to the peak, you want to remove the audience. You should not have other people present other than yourself, other family members, or if you're outside, outsiders, of course. Keep a greater physical distance. Do not touch the child. This is not a time to seek contact. You let the child vent. Don't try to communicate. You avoid confrontation, and you just have to let the meltdown progress. You must be mindful of the post-meltdown depression or phase of depletion. There's a possibility of self-injurious activities. You want to speak slowly at a low tone of voice. The aim is to make the child feel better. Give them some water, give them something to drink. Be nurturing and caring, and do not push it. Absolutely not the time to discuss the meltdown. Reassure the child that things will be okay, and do not scold the child for the meltdown. As mentioned, the meltdowns are not a time in which you can reason with the child or punish or discipline the child. You will examine the triggers after the fact, not during the cycle.